Hi, my name is Kelly Wise and I'm a treatment coordinator here at Dillehay Orthodontics. So with braces, it's extra important to brush really well. Otherwise, once you finish treatment, you can end up with stains, scarring, things like that that are permanent on your teeth. So the way that we avoid this is to brush really well, also to limit anything that's high in acids or sugars. So to brush, we're going to want you to brush for the full 2 minutes, morning and night, and also quickly after snacks and anytime you've eaten anything. We're going to want you to use a toothbrush that looks like this. It's got what we call an interproximal brush at the back. You'll take that and angle that on top of your brackets and underneath. Make it to where the bristles can go right behind that wire and in between the brackets, and just gently move your brush on top in gentle circles and below, also in gentle circles. And then we'll use that interproximal brush to go right behind the wire and in between those brackets to clean any food, plaque, bacteria, anything like that that's built up in between those brackets and behind that wire. To floss with your braces, you're going to use these little floss threaders. So basically it's like a little plastic needle looking thing. It's got a big eye at the back. So go ahead and just thread that dental floss through that eye. Go ahead and put a knot in it so that it doesn't come out. And then take that floss threader and thread it back behind the wire, pull it in between your teeth and do your flossing. And then go in between the next set of teeth. So again, back behind the wire, pull it in between the teeth and along the tissue to do your flossing. We're also going to give you a little tube of toothpaste here. It's green. And so basically you just take that, put a little dab of toothpaste on your toothbrush. You can mix a little bit of water with it, brush it onto your teeth, and it will show you any plaque that you've got on your teeth. So basically brush until all the green is gone, and then you'll know that your teeth are clean. If you should have anything that's loose, broken, sticking, or poking, making you uncomfortable in any way, we're going to send you home with a container of wax. Go ahead and just pinch off a little piece of that wax, make it into a ball, kind of warm it or soften it between the tips of your fingers, and then take a piece of cotton and dry that area out that's bothering you, and then go ahead and apply your wax. So basically take that wax and just form it around that area that's sticking or poking. You'll have to go ahead and take that off anytime you eat or brush and reapply it as needed. And then if you do have anything that's broken, go ahead and give our office a call and we'll get that scheduled for a repair. If you should have a bracket that comes off, go ahead and hang on to that bracket and put it in this little treasure chest that we've included in your bag, and give us a call and bring this chest in with you so that we may replace your bracket. In order to make sure that your treatment goes smoother and quicker, there are certain foods that we're going to ask you to avoid so that you don't have any problems with breakage. Basically, you're going to want to stay away from anything that's hard, sticky, chewy, or crunchy. So most candies, things like caramels, taffy, licorice, Tootsie Rolls, nuts, peanut brittle, corn on the cob, things like that. Anything like apples, carrots, the crust on French bread, chips and pretzels, those types of things are fine. You just don't want to bite right into them with your front teeth, but if you cut them or break them into pieces and chew at the back of the mouth, you'll be fine. Also, you'll want to limit things that are high in acids and sugars because again, they'll cause the stains and scars on your teeth that are permanent. So we ask that you limit anything like soda pop, sports drinks, fruit juices, things like that. If you drink them every once in a while, it's okay to drink them with a straw, but make sure that you're brushing or rinsing after. We also recommend that you take either some Advil or some Tylenol a couple of hours before your appointments, just to kind of help take the edge off, and then keep that going for 3 to 5 days after, as needed, of course. If you have any questions, please don't hesitate to call us at 316-683-6518.